Thank you, Honourable Speaker, and I thank the Honourable Member for that question. I thank you for that question because it answers a lot of questions that people around Fiji have in terms of accessing secondary and tertiary level care in the rural areas and in the maritime areas. The World Health Organization and Fiji has embarked on universal health coverage, which is providing equity in access to health services irrespective of wherever we are. And the services provided should be of high quality. We'll be reaching the unreached, decreasing the out-of-pocket expenses, and also we ensure that we leave no one behind. And this implementation of universal health coverage differs from nation to nation. A few first world countries have achieved 100%. One of them is Netherlands. For middle to low income countries, their percentages are lesser than that. We are quite fortunate that we began discussions with WHO recently in February and also in May when I was there recently in Geneva, and also with our people here on the ground with WHO regional office, and we intend to form a project position and a project within the Ministry of Health with funding from WHO to be able to assess the impact of our universal health coverage in Fiji. Honourable Speaker, the services that are provided, one of the things that we've done in the budget to an extent in the last financial year and to a greater extent in this financial year is increasing our outreach services. We're allocating a dedicated budget in the ministry specifically for outreach services. We're increasing the frequency of outreach services and also increasing the number of specialists that are providing the outreach services. And the outreach services are conducted to the sub-divisional hospitals and to the maritime hospitals and health centers. And recently, as we talk, just within the last few weeks, we had specialists come back from Kavala Health Center, Punise Hospital, and last week Friday from Singatoka Hospital. Another concept that we've had running in CWM for the last 10 years is what is called hospital in the home, where we have patients who have come and are unwell. Maybe normally they're admitted for about 7 days. Now we admit them for 3 days. We then send them home. We have vehicles that actually go and visit them at home. And this is something that we've now rolled out to Lambasa, Lotoka, and we are thinking and planning to roll this out in the other subdivisional hospitals in the rural areas. The decentralization of services has meant that our specialists has been able to go to certain areas, but also meant that we've been able to establish the Makoi maternity unit as a specialist maternity unit that's within the Laminosori corridor. The consultants and the senior midwives from CWM are running that unit, Honourable Speaker. We also work the marine vessel Waqainabete, which was purchased last year for about 8.5 million, and this has been travelling around the maritime areas, and it is our desire in every financial year that we will visit almost all the islands in Fiji every year, given that we have patients on the islands that we're going to visit. And as I've said earlier in Parliament in the beginning of this year, we visited the Lau Group, we visited Lomaiviti, we're intending to go down to Kandau. It was planned for next week. Unfortunately, at the moment, there's a few repair works that are happening on our marine vessel Waqainabete, so that's been postponed for another few weeks. We also have visiting overseas specialists. And one thing that I'm quite happy about, Honourable Speaker, is that we have groups of people that have come from overseas and they've indicated we want to help this particular geographical area. The Honourable Dr. Ratu Antonio Lalbalawu, earlier in this parliamentary sitting, had talked about the Loloma Foundation from America, which have indicated that they want to work in Taviuni. Not only are they looking after Fijians from Taviuni in the Greater Thakodroba area, but also around Fiji, they've extended an invitation and people have been able to come over to access their service. We also have the Sai Foundation from Australia and New Zealand, which have indicated that they want to do the North Lambasa and Savu. At the moment in Fiji, we have the Friends of Fiji Health that have come from New Zealand. They've indicated they want to do the Highlands and the Islands, and I had a meeting with them last night, and they've said that they want to bring a group of 100 specialists and nurses and take a ship and travel around Lomaiviti and Lau Group next year. and Lions Club of Auckland, which is supporting specialist eye services around the western area. Honourable Speaker, we also have the Medivac services. The Medivac services is the opportunity to be able to go and pick patients that have been found needing secondary or tertiary level care on an acute basis. And for that, government has allocated 2.1 million in the budget to be able to pay for medical evacuation. So we continue to develop our human resource, we continue to develop the facilities, we continue to enrich the 207 facilities that we have all over Fiji, and to ensure that Fijians living in rural and maritime areas can be rest assured of access, equity, and affordable secondary and tertiary level care. I thank you, Honourable Speaker.